I just want to do a quick reminder by staying on today's call. You are giving us permission to record you. This will be posted to the ABIN website so that people who couldn't join us today, who are interested, will be able to come in and they'll be able to see the recording, as well as we'll be able to refer back to this information. And so today we have with us, we call him Dr. G. He is an associate professor of psychiatry at UAMS, a former research assistant in the Psychiatric Research Institute's Center for Addiction Research. And Dr. G has completed his residency in psychiatry at UAMS in 2017 and continued his training with a fellowship in child and adolescent psychiatry. In addition to conducting research, he currently sees patients at the Child Study Center at Arkansas Children's Hospital and at PRI's Center for Addiction Services and Treatment. And I can say I've had an opportunity to get to know Dr. G, and he is so amazing. And I'm so grateful you're here today to share your information and knowledge about adolescent substance abuse with us.
Again, thank you, Ms. Kim, for inviting me to do this presentation with you guys with ABHI Network. Kim has been an integral part of our advisory board since we started this Six Bridges Clinic. Thank you, Kim, for all your inputs and advice for our clinic. And we've been up and running for almost 7 months now, and we've seen several teens and young adults with substance use problems, and we're providing treatments for them. We're so excited to have this clinic in the state, and we look forward to the new substance abuse residential program for teens in Searcy. With that, my name is Srini Gokarakonda. I'm an associate professor at UMS. I'm the section chief for behavioral health at ACH. And I have different roles at UMS, and Six Bridges Clinic is near and dear to me because I've been passionate about starting this program for almost 5 years. Finally, it happened with the support from Blue Cross, Blue and You Foundation, and ACH supporting this. So Six Bridges Clinic stands for this 6 bridges that connects the Little Rock and North Little Rock. And we have 6 pillars of treatment, which is treating mental well-being, physical well-being of patients, support, family support with family therapy, recovery supports, and prevention educations. These are the 6 components of our clinic. That's why the name Six Bridges Clinic. Okay, so with any presentation for CME, I have no financial disclosures. So the objectives of today's presentation is to understand the epidemiology of substance use disorders in adolescents, and also understanding the SBIRT, which is screening, brief intervention, and referral to treatments. And finally, exploration of prevention strategies, and also look at the evidence-based treatments for substance use disorders in adolescents. So before starting this clinic, I was part of a team of psychiatrists that worked at YASIS Rehab, residential treatment for adults. And I've seen some patients that actually started their substance abuse early, like 10 years of age. I've seen someone who started at 9 years of age. So this is a patient that I met with when she was 19 and who started substances at the age of 9. So she said she started using alcohol at the age of 12, marijuana at 13, opioids at 15, but she started smoking cigarettes at the age of 9. And then when she came to our treatment, she was using opioids, and the drug of choice was fentanyl. And she came to us after she overdosed on fentanyl, went to detox, and then came to residential treatment. So this is a report from Wellcome Trust that publishes these reports called Pain in the Nation. especially in the areas of mental health, substance abuse, and suicides. So if you look at the graph here on your left, the blue graph shows the total number of deaths from alcohol, drugs, and suicides in the US. This was from 1999 to 2022. So you see the exponential increase in the deaths, especially from 2019. You see a significant increase in the deaths from all these like drugs and alcohol, and mostly this death rate was increased due to fentanyl. If you look at the death, the gray bar here, that is mostly because of the fentanyl use. And this is again the data between 1999 and 2022, the same data. You see the amount of the deaths here from 2015. We see significant increases due to opioid fentanyl, which is a synthetic fentanyl that caused all these deaths in the US. And some good news in 2023 was the latest data. In July 2023, the annual deaths were over 110,000. In December 2023, the total number of deaths, when they look at the deaths, they go from October to October. So from October to October in December 2023, the death rate went down thanks to naloxone, Narcan, that was distributed across the country. That has helped reduce the number of deaths. So talking about substance abuse in youth, about 4% of adolescents ages 12 to 17 has a substance abuse disorder, according to the 2020 National Survey on Drug Abuse and Health. That is almost 1 in 25 people ages 12 to 17. So the overdose deaths among adolescents aged 14 to 18 more than doubled from 2019 to 2021. We've seen the steep rise of the deaths in that age group. And then, so substance abuse costs $500 billion annually. This is approximately about $1,500 per capita. So all of us are paying $1,500 a year to substance abuse issues. That includes loss of employment, accidents, treatments, whatever substance abuse affects. That's about $500 billion annually, the cost to the nation. And then this is rates of drug overdose deaths by age groups, 15 and older. If you look at the age 15 to 24, from 2021 to 2022, there is some decrease in the deaths, the 2% decrease in deaths and overall in that age group. But if you look at the age group of 35 to 44, 45 to 54, and then 55 to 64, the deaths are still increasing in that age group, according to the study that was released in 2024. So I'm a child psychiatrist, and I see a lot of children that lost their parent to substance abuse. From 2011 to 2021, an estimated 320,000 children lost a parent to substance abuse. So this is reported substance abuse. There might be another 300,000, maybe 500,000 of children that actually lost their parent to substance abuse or have no parent in their life, whether they're dead or not present in their life. So that is a significant number that significantly impacts the children, that puts them at trauma, and then the increased risk of substance abuse in these children when they're young. So looking at the data that I showed earlier, the ages 10 to 19 years old, the death rates of from fentanyl, and then all drugs. If you look at all drugs, it's a black line here, the all drugs, and then the blue line shows fentanyl. So see there is a significant increase in those deaths from 2019 to 2021, and then there is a drop. We see this drop here. That's the 2% drop that we've seen in the previous graph. This is again released in 2021 from morbidity and mortality weekly report. The deaths from any mental health history, substance abuse, mental health and substance abuse. So any mental health, there is an increase in 40% of deaths has a history of mental health issues. And then depression is the primary driver for that, 20%. And then if you look at on the far right, people that has mental health and substance abuse, people that have mental health and substance abuse, you see more than depression together. It's about 25%, between 20 and 25%. Okay, so we know that marijuana, alcohol, and tobacco, they're all called gateway drugs. And since the legalization of marijuana in certain states, marijuana is perceived as okay to use in these teens. That has led to significant increase in use of marijuana. So is this marijuana the same marijuana that was available 20 years ago, 30 years ago? Look at the concentrations of delta-9 THC. Delta-9 THC is the potent substance in marijuana, which is a psychoactive substance that causes euphoria, that also causes psychosis if taken in excessive amounts. So delta-9 THC is responsible for the psychotic symptoms in people that use marijuana. So look at the proportion of delta-9 THC to the CBD. CBD is a non-psychoactive compound in marijuana. So look at the ratio that was in 1994, it was 14 times. And then in 2014, it's 79 times more potent than the one that was available 20 years ago. Now there's about 95% purity, so 95% like delta-9 THC, and then maybe 5% CBD in that. We see a lot of attractive advertisements that are seen in billboards marketing these products across the country. They're more like a candy store or any other store that advertises to the kids and also the young adults. So if you look at this picture that depicts the high potency marijuana right here, this is marijuana dabs, a THC dab that has 90% delta-9 THC. And then marijuana vapes, though it says CBD, but most of them have some amount of marijuana in it or delta-9 THC in it. And then alcoholic beverages, 12% of alcohol. A normal beer has 5% of alcohol. And then these new drinks that actually has attractive labeling on these products, just look like a regular Coke or regular soft drink, has 12% of alcohol. And nicotine pens, and then other attractive, pills, like, fake pills. You can't tell which one is real, which one is fake. If you look at the picture here, it's a fake fentanyl or oxycodone pill that is pressed with fentanyl. So oxycodone 30 is a real on the left, and then on the right is the fake. So you can see there is no difference when you look at them closely, but still, this is a pressed pill with fentanyl. Okay, so this is a very frightening picture that was released in Canada and again by the DEA, looking at the potency of these fentanyl and then carfentanil, which is 100 times more potent than the fentanyl. So on your left here, you see the heroin. This is the lethal dose for fentanyl. And then if you look at the middle one, which is the fentanyl, that's a little dose of fentanyl. And then the carfentanil is on your right here. So carfentanil is more potent than fentanyl, and then fentanyl is more potent than heroin here. So with this, fentanyl is pressed with pills, then these teens that don't even know that it has fentanyl in their pills, and then take those pills and then overdose on these pills, unfortunately. And then there are other substances that made to the market recently. In 2022, approximately 23% of fentanyl powder that was seized, and then 7% of fentanyl pills seized has a product by name xylazine. So xylazine is a tranquilizer that was used for animals, to tranquilize animals. It's not an opioid. It's highly potent. It's not an opioid. So Narcan cannot reverse the overdose when somebody has xylazine in their system along with fentanyl. So that has caused more deaths because of a mixing of xylazine and fentanyl. So like I mentioned earlier, alcohol, marijuana, and tobacco are considered the gateway drugs, and marijuana, of course, is a gateway drug by itself. And you look at the um, use of alcohol, binge using of alcohol, and heavy use of alcohol, cigarette use, and then as other illicit drug use when there is no past month marijuana use. If the same person or a different person has a marijuana use, look at the proportion of alcohol use went up from 8% to 44%, and then 3.5 of binge drinking to 27.5%. Look at the tobacco smoking on your left and then on the right. So if there is a past month use of marijuana, there is a significant risk of increased use of other drugs. Same here. If there is no past month alcohol use, the drug use and the alcohol use is less. Cigarette use is less. And then if somebody has alcohol use in the past month, see the amount of binge drinking, amount of other illicit drugs and cigarette use on the right. And this is also no past month cigarette use and then past month cigarette use. So cigarette use also increases the risk of other drug use, which is alcohol, marijuana, other illicit drugs. Okay, so this is something that I like to talk about because this is released by National Survey on Drug Use and Health in 2013. So they looked at the age of initiation of substance use in this population, and then from ages 12 to 13, there is about 3% substance use, and then ages 14, it's 8%, and then as you go, 11% in 16 to 17, and then and it goes down a little bit, but the amount of substance use that was used between ages 12 to 18, that's a significantly high amount of or high number of kids using substances. And that may lead to substance abuse in adults. Okay, so this is our own Arkansas data. Looking at this is from Arkansas Prevention Needs Assessment Survey, the 2023 survey. They survey kids from ages 6th grade to 12th grade. And it's a sixth grade, 8th grade, 10th and 12th grades students. And then looking at the age of cigarette use in 2018 was 14. And the age of prescription drug use in 2018 was 13. And then looking at the 2023 data, if you look at the cigarette use, age of initiation was 13, and the age of prescription drug use is 12.2. So that tells us, that more and more young kids are doing substances, whether it's alcohol, whether it's tobacco, it's marijuana, vaping, whatever it is. The age of initiation of substance use is going down as we see from this chart, especially in Arkansas. So, in the same token, I want to share this positive news from this survey. The lifetime use of cigarettes going down. Maybe 2019 to 2023, you see the cigarette use went down. And then alcohol use also is going down a little bit, from 10% in 2019 to 2023, it's going down. Cigarette smoking and smokeless tobacco is going down. And then this is the bottom graph here, right bottom shows the grades. Across all grades, 6th, 8th, and 10th grades, the substance abuse, and especially the alcohol and cigarette use went down. But if you look at the there is a dip here in the 12th grade when you look at 2020, but it significantly increased during COVID time and then went down again after COVID. Surprisingly, this is something that surprised me when I looked at the data, looking at the boys to girls. On your left, the dark green is boys. On the right, the light green is girls. Cigarette use, smokeless tobacco, hallucinogen use, ecstasy, and steroids are most commonly used by boys, right? And then we look at the right side of the graph, the picture that shows more alcohol use in girls, more marijuana use in girls, inhalant use in girls, or the counter prescription drug use. And alcopops, the sweetened alcohol drinks, almost 11% in girls. So this is very concerning, right? I don't know if the response rates to the survey, maybe girls were more truthful in answering the questions, or boys did not answer these questions, whatever it is, but it's about 48,000 kids sampled. So even if some kids did not respond to them truthfully, you see there is a lot of sample that can adjust that. So there is significantly high amount of substance abuse in females and girls in that age group. This is brain development from ages 5 to 20. So the more blue the brain here on this picture, that means the more mature the brain is, more developed the brain is with the white matter and gray matter. And then the more you see on your left, the yellow areas and the green areas depict the maturing brain. I'll not go in details of this slide in the interest of time. I'm going to show you something very simple and basic. So on your left here, as we age, the prefrontal cortex, which is the frontal part of the brain, develops as we age from ages 5 to 20. So 80% of the brain is developed by the age of 3, and then from then the brain still matures as we age until 21. And then you're looking at the development of striatum. Also, there is a significant development of striatum in teens, and then it normalizes by the age of 2021. So you look at the prefrontal cortex and you look at the striatum. Striatum is like a gas pedal. Like you have a car full of gas, right? And then the prefrontal cortex is your brakes on your car. So looking at this, there is not a proper connections. This is a dotted line between striatum, prefrontal cortex, and prefrontal cortex to striatum. In adolescence, there is a significant connections between striatum and prefrontal cortex. That means, they hit the gas pedal so fast, right? So many times. And the prefrontal cortex, which is supposed to be your brakes, is not fully developed, right? That means that the teens are more impulsive. Let me go back to the previous picture. They looked at the impulsivity, sensation seeking. This is the behavior on the top here, on the left top. The red shows adolescence, And then the impulsive behaviors in adolescence is higher, even though the impulsivity in children is high, but they don't have access to these drugs, right? That's why they may not be as um, they may not be using substances as much as the adolescents because they have access to substances. Um, so nuclear, if the bottom one here on your left is the brain that shows the activity of nucleus accumbens, which is the striatum, is high in teens compared with the prefrontal cortex, which is less. So this is what we're talking about. So the teens have more striatum, there's more gas, and less brakes on their brains. And then if you look at on the right side, the prefrontal cortex is fully developed, the striatum is mature, and they have meaningful connections or more connections between striatum and the prefrontal cortex. So you have less, chance of impulsivity and sensation seeking in adults compared with the teens. Risk factors for substance abuse. There are so many risk factors: community, family, school, individual. These are places where kids can be influenced by drugs, right? And either a group of teens doing it, or they're exposed to school, school. And then between friends doing drugs. And then, there is definitely a genetic predisposition to substance abuse. A child, somebody who's has a family history of alcohol, family history of other drug use, they're more poised or more prone to substance use as teens and adults. So substance use is a multifactorial. So you cannot pinpoint on one thing, either on the genes or on the community or the life. So it's a multifactorial. And then trauma plays a significant role in substance abuse. So how do we identify these children and who has been using drugs or who've been experimenting with these drugs at a young age? So the screening behavioral intervention, screening and brief intervention and referral to treatment was developed at the Boston Children's Hospital as Mass General Hospital. And they have this toolkits that actually provides different available screening tools for different substances as a whole. So the basic idea of this screening is to identify individuals who are at risk of developing substance use or alcohol use. And then somebody who's screened positive, then we need further evaluation and treatment for those kids. And then if they have a positive screen, and then they need to be either referred or followed by the PCP, because PCPs, every kid sees a PCP or a pediatrician, in general, like at least once a year, every visit. So it's easy for them to screen at that visit, and then if they test positive, either they can do a follow-up visit or refer them to a substance abuse facility like us at Six Bridges Clinic. So this is a toolkit, again, as I said, developed by the Boston Children's and Mass General Hospital. The goal is to identify the substance use as early as possible, as recommended by the AAP, American Academy of Pediatrics. There are multiple questionnaires. CRAFT is one of those questionnaires, and then screening to be brief intervention is another questionnaire. BSTAD is another questionnaire that was developed by these groups. And these screenings are done less than 5 minutes. And once they screen positive, you can do an intervention. I'll show you one tool that we use in our clinic. It's CRAFT. These are all the tools that were recommended. Um, and again, this is another study that shows the importance of screening and behavioral intervention in primary care clinics. And they compared different tools. They compared the National Institute of Alcohol Abuse screening, and then they used audit, alcohol use disorders identification test. They used CRAFT, and then PESC, which is the personal experience screening questionnaire. There's 87% sensitivity with NIAA, which is National Institute of Alcohol Abuse, and then 97% sensitivity. That means recognizes people with substance use. True positives is 97%, and then PESC is also 97%, and audit is only 70%. So we use CRAFT. Based on the evidence in our clinic, we are using CRAFT as our screening tool. So CRAFT has 6 questions, audit has 10 questions, and NIA is two question screener. This is the NIA screening tool, the first question and the second question, and then it asks different questions for elementary, middle school, and then high school kids. So in high school kids, how many days in the past year have you had more than a few sips of beer, wine, or alcohol? And then how much, if your friends drink, how many drinks do they usually drink on an occasion? So it's basically asking a person's drinking habits and then the environment they are in, so to assess the risk of some alcohol use. Skip this. Skip that. So this one shows the highest risk with 1 to 5 drinking days, less than, so if somebody is drinking 1 to 5 days of drinking in the age group of less than 11, they are high risk. Somebody from 12 to 15, there is also a moderate risk of alcohol use. And then somebody who's drinking 24 to 51 days, there is a high risk in these individuals. So the risk goes up based on the number of days of drinking in a month, and based on the age groups. We all know the standard drink is about 12 ounces of regular beer with 5% alcohol. But when we were talking about the beers that are coming these days is 12% of alcohol. And then the table wine is 12% of alcohol, which is a 5 ounce table wine, and then 1.5 ounce shots of whiskey or gin or rum, which is 40% alcohol. So if you look at the problematic drinking defined by National Institute of Alcohol Abuse, 4 or more drinks on any day for women, or 5 or more drinks on any day for men is considered as problematic drinking. And then the other is 8 drinks or more per week for women, and then 15 or more per week for men is considered as a problematic drinking. Why are women more vulnerable for substance or alcohol use? Or they have less threshold? Because there is, first of all, it's the enzyme. Alcohol, aldehyde dehydrogenase is an enzyme that converts alcohol to aldehyde, acetaldehyde. So that is more active in men and less active in women. So even women drink less, they have more effects of alcohol than men. So that's why the problematic drinking is like 8 drinks per woman and then 15 drinks for men. Okay, so just going back to the CRAFT, the screening that we use here in our clinic, it's a tool that is developed to use between ages 12 to 21. It's very brief and efficient, and it takes less than 5 minutes for vaping and then it's 97% sensitive. And then any score of 2 is a cutoff point. If somebody scores more than 2, then they are positive for substances. So the craft asked these questions during the past 12 months. On how many days did you drink more than a few sips of beer, wine, or drink containing alcohol? So here it quantifies by asking the number of days they use alcohol. Then same with marijuana. Use of any marijuana products or synthetic marijuana. So also ask for the days, number of days, and then and anything else to get high. This includes prescription pills, over-the-counter drugs. So dextromethorphan, which is a cough syrup, is something that we see in our clinic a lot. So that's been a trend recently. So cough syrup, any of that is the number of days. So if they put zeros on this, we ask one more question, which is the fourth question, and then we stop. The fourth question is, have you ever ridden in a car driven by someone who was high or had been using alcohol or drugs? So the reason again is to educate the teen about risk of um, you know risk of being in a car driven by someone who has drugs or alcohol. So if they answer zeros to all these three questions on the first screen, and they answer yes to this one, you provide education about safety, safety education, and then move on. And then if they answer like 10 days in the last month or 10 days in the year, last year, then you go on to ask all these questions. The next question is, do you ever use alcohol or drugs to relax or feel better? And then do you ever use alcohol or drugs while you're by yourself or alone? And do you forget things you did while using alcohol or drugs? Do your family or friends ever tell you that you should cut down on drinking or drug use? And then the last question is, have you ever gotten in trouble while using drugs? So if the answer on any of these questions, if the answer yes, then that means they're positive for substance use, and then you provide education, which could be a brief intervention. Uh, and then if they need more than that, then you refer them to the nearest clinic, substance abuse clinic. So here is the scores. The risk of or probability of substance use disorder by the Kraft score. If somebody answers a score of 1, the risk is 30. If somebody answers positive on one of those questions, then the risk is 32%, right? If they answer yes on 2 questions, it's 64%. And then if they answer 5, then it's 100% risk, right? The risk exponentially increases if they answer, 2 or more questions on the craft. So once the patient completes this, we review the results and then recommend not to use. Basically, provide education that alcohol and marijuana can affect your brain, your learning and memory, put you in embarrassing situations, put you in dangerous situations. So that's why you recommend not to use these substances. And then somebody who's riding or driving in a car with alcohol or drug use, then you can always say that crashes happen when somebody is intoxicated on drugs. So you can definitely talk more about that to educate the teen and also the parents who are with the teens. And then if somebody is not using any drugs, then you can congratulate them and say that I'm glad that you're not using any drugs. You can continue doing the good work, and do not use any more drugs or any drugs. So reinforcing the self-efficacy of the child or the teen should be the last hour of that. So 5 hours after you've done the screening. And these are the questionnaires that are available on this NIDA NIH website. You can use any of these 3 screens. They are available online. You can score as you go. since we don't have much time left, I'm not going to use, usually I go through that and then use that screen while you're on the Zoom. But since we started a little late, I'm just moving on with this. I can share this link and presentation for you guys. Again, risk stratification, if somebody in no risk or low risk, no further treatment is required, and repeated annual screening. If they're doing it in the PCP's office, do it annually. And then if there is a moderate risk with two or more questions, then you do brief intervention. And then somebody has a moderate to high risk, brief treatment on site or via treatment referral to a clinic. And then somebody who has severe risk or dependence, specialty treatment is required. Somebody who has been drinking alcohol every day, they might need a detox, right? Refer them to residential treatment if needed. So these are some studies that looked at the sensitivity and specificity of these questionnaires. And they all, the screening to brief intervention, BSTAT, and all of these questionnaires are equally sensitive in identifying these patients with substance use. And this is the study that has showed the different questionnaires that were used and the sensitivity of those questionnaires. This is the results section of these questionnaires. So if you look at the screening to brief intervention, they were 90% sensitive. They're 90% of the time they were able to identify tobacco use, cannabis use, and then specificity is somebody who are true negatives. So somebody who don't have a substance use, they are 97%, 98% sensitive to exclude them. BSTAT is about 100% sensitive in tobacco detection, alcohol detection. And then TAPS is another one they use, but it's not as sensitive as the BSTAT and S2VI. So if you were using, so these are for all ages, and it can be used in teens as well. CRAFT for ages 12 to 21, and screening to brief intervention BSTAT for anyone over the age of 12. And this is another one that looked at the expert in primary care. So looking at, this was published in 2021, compared to, so they used expert in some one of the groups, and then they did not use any expert. So in another group, so compared to usual care, expert group had lower odds of substance abuse. The odds are 8.8%, 80% in group that don't have expert. And alcohol, odds of alcohol use 0.69, and any drug use was 0.73. So they have lower odds. Somebody who has been screened annually, screened regularly with expert, and then providing brief intervention, the risk goes down. This is also another study that looked at having expert screening in primary care along with a behavioral counselor in the clinic. So having a counselor in the clinic, this is a small number, which is only 7 patients. So I'm not putting too much weight on this, but this is a model where you can use a pediatrician and then a therapist in the office, and then providing the therapy will improve the chances of not using drugs. And then how do we manage these kids and teens that are using substances? I mentioned my patient Sarah with this name. We changed the name, of course. This patient went to residential treatment and then went to intensive outpatient treatment, and then followed it in our outpatient clinic here at CAST. And she was sober. This was like a year ago. So she's sober and working or employed full time at the end of 3 years. So treatments work. So we just have to be more persistent and help these patients by sometimes they relapse. We still help them, bring them back to treatment with your help. So these are like evidence-based treatments, well-established standalone interventions, family-based treatments, cognitive behavioral therapy, multi-component psychosocial therapy. These are well-established treatments for substance, any substance. I'm not talking about just opioids, any substances. This is the best treatment, CBT and family-based therapy. And probably efficacious motivational interviewing therapies. And then 12-step programs are also helpful. And then adjunctive interventions, I say adjunctive for medications. Adjunctive interventions include pharmacotherapy, exercise, yoga, and other mindfulness techniques. Okay, so like I said, CBT, family-based therapies are the evidence-based treatments for substance abuse. Okay. And then motivational enhancement therapies commonly is a 3 to 4 session that combines MI and CBT techniques to bring in somebody who is not interested in coming to treatment. So you talk with them, you engage them, and bring them to treatments after a few sessions. And then a lot of you are aware of MI. So MI uses 4 core principles. So this is MI principles. In the interest of time, I'm just skipping these. So the evidence-based pharmacotherapies for nicotine, we have Chantix, we have bupropion, we have buprenorphine for opioid use disorders, and we have methadone, and naltrexone for both opioid and alcohol use disorders. Okay, somebody who has opioid use disorder that was using methadone and contingency management plus psychotherapy, the response rate was 21%, and then with buprenorphine it is 31%, and with naltrexone it's 31% retention in these treatments. These are looking at retention in treatments. And then N-acetylcysteine is something that is used for cannabis in adolescents. These are some, so we are not using telemedicine, but once we establish ourselves more, I think, and our plan is to do telemedicine for across the state. Right now, we are treating anyone within the 60-mile radius within the central Arkansas. So once we have a telemedicine capability, we will expand our services to across the state. Okay, so lastly, this is the last slide. Six Bridges Clinic, we see patients ages 12 to 21 with any substance use. We provide a comprehensive screening and evaluation and provide mental health treatments. We are located at UMS Psychiatric Research Institute, 4th floor. We are open from 8 a.m. to 5 p.m. For all referrals, please call the 526-8487, or you can email sixbridgesclinic@ums.edu. With that, I'm sure I'm just 1 minute over time. So if you have any questions, you can ask me now. If anyone has to leave, you can, please feel free to leave. And if you have questions, please send me an email. I can share this PowerPoint and also answer any questions you may have. Thank you again, Ms. Kim, for the opportunity. And thank you all.
We appreciate you being here, and we appreciate you taking the time out of your schedule. We did have one question in the chat that I wanted to see if you'd be able to answer.
Sure.
And the question is, have you found any relation to teen substance abuse related to childhood ADHD medication?
That's an excellent question. That is a question that I get a lot in our child clinic and also in adult clinic here. So untreated ADHD increases the risk of substance use, especially tobacco and alcohol use. There's a lot of evidence for that. So there is a study that followed kids that were diagnosed with ADHD at age of 50, age of 5, and then they followed them until 20 years and looked at the development of substance abuse in these children. So tobacco risk and alcohol is high. On the same token, somebody who's diagnosed with ADHD and they're not treated with ADHD medication, there is increased risk of substance abuse because they're managing their symptoms. Somebody who cannot pay attention, they want more caffeine, they want more nicotine and alcohol to focus, right? So they're using substances to focus. So ADHD untreated can increase the risk of substance abuse.
Thank you. Um, we appreciate you answering that question. And Jenny has put in the information on how to get your continuing education certificate today, as well as there was a question, will we be sharing the slides? And yes, you graciously agreed to send the slides, and we will put your slides with the recording on our webinar so people could refer back to all this important information. With that, I know we're a little over time. Dr. G graciously agreed. If you have questions, don't hesitate. You can send your questions to us. You can send them to Dr. G. We appreciate you, your time today. And next month, we will have peer recovery specialists on. We'll be talking about a pilot project that we are doing with emergency departments and peers. And so we look forward to seeing you then. Have a wonderful day and take care.